Hello viewers, I'm Sangeeta Kopalkar for Sargam TV, and today we have come to meet Dr. Sarb Hundal from Mission Valley Center here in Fremont. And today we are going to ask him some common eye ailments and how to treat them, how to take care of your own eyes. So let's meet Doctor. Hello Doctor, how are you?
I'm good, how are you today?
Very nice to meet you again.
Good to see you, Sangeeta.
Thank you. So last time we spoke about some serious eye ailments and how to cure them, how to treat them. So today I want to ask you about some common eye ailments which are like occurring maybe regularly. People face them and they do not know what to do. So can you let us know about some common eye ailments which normally patients come to you for that?
Sure. I can sort of go through the common things that people generally come to see us for. Then we can elaborate more on each condition if you want to know more details.
Sure.
The run-of-the-mill stuff that typically affects people at any age, of course, one of the commonest one is the pink eye or the red eye.
Okay.
And in addition to that, issues of watery eye, itchy eye, dry eye, styes on the eyelids, and contact lens wearers have their issues with red eye, sore eyes, and these are the things that we typically see in day-to-day practice,
Okay. So first thing you mentioned is pink eye or red eye. What exactly is that?
Well, first of all, red eye is a very basic and broad term. Red eye means that the white part of the eye becomes more reddish in color. So if it's very red, blood red, and mostly in one part of the white part of the eye, that is what we call a conjunctival hemorrhage. Patient typically has no symptom. They don't even know it's there until they go look in the mirror. And that condition happens for no particular reason, and it generally goes away within about 7 to 10 days. So no reason to worry.
Oh.
On the other hand, the classic pink eye is when you have infection in the eye. It could be virus, it could be bacterial, sometimes just allergic in nature. There the eye is reddish but not dark red. It's watery, it could be itchy, it could have a lot of mucus and junk coming out. There you should see the doctor and get the appropriate medication.
Okay. So for what you said is like if it's a bacterial or viral infection, the doctor only has to give some medicine, right?
Exactly.
You cannot
you can try over-the-counter anti-itching medication. If the symptoms are mostly itching and watering, you can try the eye drops from the over-the-counter from the store. But if it's significant discharge and the eye is uncomfortable, then there's a most likely infectious process going on, and it's good to have the eye looked at.
True. And sometimes, as you said, you mentioned, I understand what a stye is. There is a small kind of a bump on the eye.
Yes.
So what is it? Why exactly does it happen and how to treat that?
It's a fairly common thing, and it can generally present in two different ways. One of the presentation is extremely red, painful, little bump on the eyelid, upper eyelid or lower eyelid. What happens is the glands of the eyelid which produce the lubricating tears of the eye, the gland can become blocked and then it gets infected. So it's a combination of infection as well as a blockage of the gland that creates the red sore spot. Generally we need to use local antibiotic drops to treat them.
Okay.
On the other hand, sometimes the bump may be not painful but it's just there. And that means the glands are just blocked with some inflammation but there's no infection. And then the treatment is different. Sometimes we have to surgically open that and drain it out, These are called hordeolum or chalazion in medical terminology.
Okay. And what exactly is like sometimes the eye itches, it waters.
Yes.
So why does it happen and what is to be done in that?
It's a fairly common condition that we see. Itchy watery eye could have 2-3 common reasons. One of the commonest is of course allergy. If you're allergic to any pollens, any kind of stuff in the atmosphere, your eye is going to get very itchy and it's going to water. For that, there's anti-allergic medications available both in the form of eye drops and pills. Or of course you can see the doctor and they can give you more specific medication for your case. But there's also other conditions that can cause itching and watering. Some of them are infections, and some of them are actually dry eye conditions. If the eye gets extremely dry inside, which is a fairly common condition, I'll talk a little more detail on that in a second. So dry eye gives you symptoms of itching, and then the brain gets a signal that the eye is getting very dry, so it makes the backup gland produce a lot more water. So suddenly the eye starts watering, Dry eye is extremely common in California because California has absolutely no humidity in the air. It's very dry weather. Number one. Number two, in this day and age, we're using so much bright screen. We are always on the gadgets. We are on the iPhones, or we are on this iPads, or we are on the computers.
True.
That makes the eyes more dry. So the best thing is, number one, to use lubricant eye drops, artificial tear drops. They're available on the over the counter. Secondly, you can also use hot compresses. You can take a wash towel soaked in hot water, keep it on the closed eyelids for 2-3 minutes once or twice a day. So गर्म पानी का सेक, गर्म पानी की टुकोर है जो, that can help the dry eye quite a bit also.
Okay.
And so that's what I recommend to a lot of my patients. Very common in the older patient, but also in younger people who are on the computer all day. And also pretty common in contact lens users, because they get dry eye also,
Oh, okay. And in fact, I was to ask you about sometimes people who use contact lenses, their eye itches or it hurts.
Yes.
So what do they do in that?
Contact
what should they
lenses,
do?
yes. So there's a lot of younger population that use the contact lenses, and many of them either don't know or they do not take good care of the contact lenses. First of all, ideally, if you can afford it, use daily wear contact lenses. That's the safest. You put the brand new lens in the morning, you throw it away at the end of the day. So you don't need to worry about cleaning and infection or issues, But if you're going to be using bi-weekly or monthly basis kind of contact lenses, then you got to clean them properly and make certain you don't sleep with the lens in your eye. But still, in spite of that, you can sometimes get infection in the eye. So if your eye starts to become red or sore when you have contact lenses, first thing is take the lens out and throw the lens away. And if you don't get better overnight, maybe 24 hours all you should wait, then you should be seen. Because you could have serious infection developing and it should be looked at. Or it could be something milder like a little reaction from the chemical solution that you use to clean the lens. So the best thing is to take the lens off, see what happens over the next day or so. If it doesn't get better, have it looked at,
Sure. Thank you so much, doctor. And in addition to all these things, all this information, if you want to give any particular suggestion to our viewers.
Basically, especially in this day and age, starting from the teenager all the way, we are doing so much more bright screen exposure of our eyes. If you have to do it because of your profession, try to every 5 or 10 minutes when you're on the computer, close your eye for about 5 seconds, or just blink more often, or just look away from the bright screen. Number two, you can always use some over-the-counter artificial tears or lubricant eye drops as needed. It just keeps the eye lubricated and minimizes the eye getting tired. Number three, if you haven't seen an eye doctor for a few years, it's a good thing to have it looked at. Make certain you don't need any glasses or something else that can be necessary to look at, or take care of.
Okay. So for the number 3 one, you have to come and see Dr. Hundal. And thank you so much, doctor, for sharing all this good information. I'm sure our viewers must be knowing a lot about eyes, its conditions, different diseases, different problems. So they will contact you, and as I have already mentioned, and it comes on the screen, that you have to check for Mission Valley Eye Center website. Okay, missionvalleyeyeCenter.com, and we have already given you the number. The number is 510-796-4500. Thank you so much. Thank you, doctor.
Thank you, Sangeeta. Good to see you.